Hello everyone, this is Tyler here. It is February 10th. It's almost Valentine's Day. And many people want to know is a question, and that is if life or is health insurance important to have if I'm living abroad as a young person. And my simple answer to that is yes. It's definitely important to have, and it's definitely something you should get, especially if you're living somewhere long term. Now, I'll explain some reasons why you should have health insurance, even as a young person, and why it would be very useful. Okay, so as we all know, health insurance isn't always cheap, especially if you come from USA. Health insurance can be exceptionally expensive, and it's difficult for people who make below a certain income. Now, unfortunately, illnesses and accidents occur that can be extremely expensive, and there's also the chance of a disease or cancer or something that can also be quite expensive. So with all these factors considered, it's often important to weigh the pros and cons of insurance and or not having insurance. And often the case is yes, you should have insurance, because if you look at countries such as America, where a 3-day hospital visit could cost over $30,000, a health insurance premium per month is well worth the cost. And it's also noteworthy that the hospitals and clinics in foreign countries are also required to provide you with a certain level of care if you have the insurance. So yes, keep in mind that if you're a foreign person living in a country and you have a private plan, when you look at the average incomes of that country compared to the cost of the insurance, it's probably cheaper to have the insurance in that country compared to if you were to have insurance in the US. And also keep in mind that all plans typically come with free services. This is often in the form of preventative care. Every healthcare plan has preventative care measures that are there to keep the cost of medicine lower in the long haul for patients. And these free benefits can include annual physicals, vaccines, services specifically for women, blood pressure and cholesterol screenings, and many more things here. So this is all included in these insurance plans, and this is actually the cheaper way when you look at healthcare costs. Having these preventative measures will actually keep your healthcare costs lower in the long haul. The next thing is that you're likely to qualify for very low prices. When you look at health insurance plans internationally, there's often a breakdown of different premiums, and there's obviously there's different needs. So per your needs, you might be surprised. In many countries, you could probably find a health insurance plan for like $30 to $50 a month. And this would be for a pretty high level of healthcare. Now, often healthcare does not include dental care or international healthcare, so that is one thing that you'd have to factor in on the side. Now, the next thing is that there's very simple and affordable plans out there, and you'd be surprised. Finding a international healthcare plan can take very quickly. Within a half an hour, you can have a plan figured out. It's actually quite different, the healthcare plans, if you're international compared to if you're domestic, if you're from the US. Often the healthcare insurance plans can be much more complicated, and it can take quite a bit more time to find something that's suitable for you, and that also comes with a huge premium. Keep in mind that when you look at cost of an accident or illness, cancer, these things, that this healthcare, if you're paying $50 a month, which is about $600 a year, will probably be much lower than if you have an accident or illness that could be in the thousands, even if you're living in a foreign country. So in these cases, it's very optimal to have insurance. Also, keep in mind that some countries require insurance plans to live there long-term, to be granted a long-term visa or residency. You're required. Some countries require a health insurance plan even to obtain a visa. If you want a Russian visa, they actually require a health insurance plan. So it's very much, it's best just to have a plan in place and see what your options are.